How's your week been so far?
That's been okay. Just a whole bunch.
Good evening, Chairman Leach, honorable board members, good evening. We appreciate the opportunity to present to you today. My name is Adam Wilson. I currently serve as a outside consultant to San Diego LAFCO. I have 17 years of prior local government experience working for County Supervisor Diane Jacob and the Board of Supervisors. So I truly appreciate your guys' level of effort and commitment to your guys' community, because that's near and dear to my heart as well. I'd like to thank your CEO for putting us on the agenda and giving the opportunity for speaking tonight. And this is why we're here. Me and my colleague Carol, we're here to provide you a brief presentation of who San Diego LAFCO is, what we do, and why we're here to you today is to present a project that will have your great interest at heart. Very briefly, for those that don't know, San Diego LAFCO is a very small, obscure government agency which oversees all the special districts in San Diego County, whether that be water districts, sewer districts, cemetery districts, fire districts, and in your case, healthcare districts, in which there's 4 in the region. yourselves, Tri-City, Palomar, and Grossmont. The main job of what we do at LAFCO is perform these municipal service reviews. And very briefly, they're comprehensive studies that look at the overall health of a district. And we do them for every district. And they typically are done to look at financials, the operations, the management, the governance. And in some cases, we can drill down deeper when needed. And so what we're here today to is present to you that we're about to embark on a municipal service review on the 4 healthcare districts in the region. And it couldn't be any incredible timing considering what's going on in the region, as we all have seen and read, not just with Tri-City and Palomar, but as you guys have probably well aware, healthcare services and programs are vastly delivered differently from when healthcare districts were established back in the 40s and 50s. And so we have a tremendous opportunity to look at this study and comprehensive review and look at how can we more effectively and efficiently deliver healthcare services and programs to these communities and these districts. And so that's what we're here for tonight. And I'll pass it over to my colleague, Carol, who will dive into this in a bit more detail.
Thank you, Adam. Alrighty, good evening, Chair Leach and fellow members. As Adam said, I'm Carol Aron-Lehman. I'm an analyst with San Diego County LAFCO, but more importantly, I'm serving as the project manager for the municipal service review for the healthcare district. So I am overseeing this project. If we can just go to the 3rd slide, I'll be in there. The 3rd? So yes, this one. Oh, one back. Awesome. There you go. So I know a lot of people, I can confidently say, don't really know who LAFCO is or what we do. So I do want to start off just by giving a brief background to LAFCO, a little history, as you would say. So LAFCOs were formed or established back in 1963, and we are political subdivisions of the state of California and are responsible for providing regional growth management services in all 58 counties within the state. We are comprised of locally elected and appointed officials who have regulatory and planning powers delegated by the legislature, which is the CKH, which is short for the Cortese-Knox-Hertzberg Local Government Reorganization Act of 2000. It's a mouthful, so we just call it CKH for that reason. So they are there to coordinate and oversee the establishment, expansion, and organization of cities and special districts. We can go to the next slide, please. And now building off that, just to give you guys an, Adam touched on the municipal service review and an overarching approach. And so I'm just going to go a little bit more into detail and hopefully answer the why and the what as they are I'll call them MSRs. So MSRs are, according to our government code section of CKH 56430, it requires LAFCOs to regularly prepare municipal service reviews for cities and special districts prior to or in conjunction with sphere of influence updates. And this is at a baseline. However, our LAFCO in particular has a policy in place according to our work schedule or study schedule, where we aim to do these MSRs on a 5-year cycle. So every 5 years, we're looking to give an MSR for a district or the city. And for the healthcare districts, the last one we did was in 2015. So we definitely have not hit the 5-year mark on that one. And so it's what prompted us to come forward, as well as what we know is going on in the region. And the MSRs mainly help to inform us of potential sphere of influence amendments, but they can also help inform us of needed boundary changes. And as a whole, the MSRs help us to analyze the governance structures and efficiencies of service providers and allow us to identify opportunities for greater coordination and cooperation between service providers. So that's hopefully a what and a why for the MSRs. We can go to the next slide. So now getting into the contents of the MSRs, on this slide, it kind of breaks down on what you can expect with what's within the MSRs itself. So there's 3 chapters. Chapter 3 is where the bulk of the information lies, as this is where we have our agency profiles. And the example you see here is really specific to a lot of the cities and special districts that provide water, wastewater, and fire services. So for the healthcare districts, the way we tackle, especially section 6, which is the municipal services, that's where we're really going to rely on the stakeholder groups' input and collaboration with that. So it's not going to be what you see listed here. We're still kind of needing to identify the core functions and services so that can and capture what's provided there. But yeah, that's pretty much the bulk of it. It is a comprehensive document, as Adam mentioned, and we really, our goal is for it to not sit on the shelf. We want it to have purpose. So that's our goal with this. project. And on the next slide, I can go over some of the timeline. I mean, first and foremost, this project is number 2 on our study schedule. So it is a top priority at our organization. So we are going to expend a lot of resources to getting this done as quickly as possible. We have a goal to have it done within this fiscal year, but this will rely on external and internal factors. And it is going to be it's a big undertaking, and it's going to be a really comprehensive document. So that timeline, I can't accurately say when we would have it completed by, but right now we're in between the data gathering and intro meeting stage. And this is basically to us just going out, doing these introductions, letting people know what we're doing and why we're doing it. And then, as we're doing that, we're starting to collect data to get things put together. Once we have enough data, we kind of prepare the administrative draft. Once we have a pretty solid draft, we like to get that circulated for some feedback. So this will be sent to the 4 healthcare districts in this particular case to get some comments. And we'd like to incorporate those suggestions and comments into the draft before we present it to our commission, which will be coming here down at the first draft out of hearing. Once our commission decides like, hey, this is good to move forward, we have a 45-day comment period where we also allow additional opportunities for more feedback, more suggestions before the final draft or final copy is completed. And this is not only just for the subject agencies, but also any interested stakeholder or party that wants to provide some comments onto it. And then we have a final draft that we present to our commission. And so from start to finish, that's kind of the overarching timeline of this project. Some take a year, some could be sooner, some could take 2 years. It really just depends on the undertaking. So yeah, that's pretty much my presentation on it. And I'll go ahead and hand it back to Adam for it.
And I just want to add one more thing to the process is that we really want to embark on this and being inclusive. And that's why we're here today is I think previous MSRs, if you read them, they read as book reports, they read as almost, I guess I want to try to say, I don't want the impression to be like, hey, we're a big bad regulatory agency sticking our nose in your tent and telling you what to do. That's not what this is about. We want the process to be inclusive. We want to work with you. We want you to help us, whether it's through data information, whether it's the needs and challenges. And through that process, we are going to be forming a stakeholder group that I'm hopeful through communication with your CEO, whether it's a staff member or a board member, we want you to be a part of that process. And so that process will be embarked in the next couple of months or so, but we're hoping through that stakeholder groups that we can kind of find the common themes in the region. What are the key takeaways? What are the challenges? And then like Carol said, we want an end product that is effectively going to invoke real change to the community. And so we're here for your buy-in, we're here for your support. And as Carol said, if you guys have any questions, we're more than happy to answer them.
Given our district and size in 2017 being the last one, what is the expected time frame to complete this? What are you hoping for?
So the last one was 2015, and she can add, but this is a priority project for our commission. It's
Number 2
on our work plan. As Carol indicated, I'd say typically most MSRs take about a year. But having said that, I know the complexities of your world are quite challenging. So I would anticipate it could take longer. I know our board is pushing to get something done as quickly as possible, but I don't think that timeline would want to jeopardize the substance of the report. So
Okay, thank you.
a roundabout way of answering that.
A year, hopefully.
Yes.
So you'll
Yeah,
be
yes.
doing
Plus or minus.
all of the healthcare districts simultaneously
Correct.
and then issuing individual reports or as a whole?
It's going to be as a whole document that'll have all the profiles. We have had discussions about breaking up by doing North County versus East County and doing that as part 1 and part 2.
Mm.
But at the end, it's all in one document. But how we present it to the commission, we're thinking of doing it in that way so it's more digestible, given the complexities of it and how there's going to be a lot of information to digest. So that's been talks at
Okay.
our office. Yeah.
I'm very familiar with you because I worked on the water issue, so LAFCO is emblazoned in me at this point. 2 questions. You mentioned stakeholder group,
Yep.
and I'm wondering how do you select, are the stakeholders that are involved in this selected but with you and our entity? In other words, we crowdsource it and decide here are the 10 people who know the most about our work. How
Yeah,
does
so
that
we've
happen?
already continued that outreach. So I've talked with people in the healthcare industry within the districts, and I've talked with people outside of the districts that are in the healthcare world. I think what we're looking for is kind of a broad approach. People that know your world, certainly people involved specifically with your district, and all the districts. And so I think it's a broad approach, a paintbrush, that we want any and all, and the brightest minds that could contribute a collective effort towards this comprehensive review.
And may I ask a second question?
Absolutely.
Okay. You mentioned that, and I totally get it, and I'm glad that we do this with our public agencies. Unlike health, or unlike water or fire or cemeteries, the healthcare world is speckled with entities that aren't in the healthcare districts. And if you're looking at how the region develops and delivers, how do you account for the impact or non-impact vis-a-vis Scripps kicking out 32,000 people off their Medicare insurance? How do you factor that into this regional impact of healthcare?
That's a great question. I think those are questions we're still answering ourselves.
Scratching.
Exactly.
Yeah.
I think the biggest question that Carol and I have from the start is how deep do we want to drill on this? You know, obviously we don't want to drill too deep where we're just getting bogged down to a sloth of information that we're just going to get lost in. But also we want it to be comprehensive enough to invoke that real change. Carol and I aren't the experts in any of this, so that's why the stakeholder group will be imperative to kind of help develop the scope. Because you're right, as we've learned from the start, it's not just the healthcare districts, it's the hospitals, it's the community clinics, it's the neighborhood clinics, it's the private, clinics. And so that's something that we've been challenged with ourselves. We've got some consultants and some interested stakeholders that are going to help us understand that ecosystem a little more. But through your engagement and buy-in, I'm hoping you guys could help with that as well.
And you have an interesting hybrid with Tri-City because they now have a UCSD partner.
Correct.
Which is totally a different entity
Yeah.
because it's university-based, publicly
Yeah.
funded. So you use a term, invoke change. Is the mindset going into this on LAFCO's part that things have to change?
I would say that's not the
So what
mindset,
does
it's-
invoke change mean then?
I guess what I'm saying is the study is going to look at our services being provided to the community adequately. And then more importantly, are there better ways to perhaps efficiently or more effectively deliver those services or programs? And that's where the stakeholder group, I think, is going to play an important role. LAFCO doesn't have an agenda here. The agenda is to put some heads into a room through the stakeholder group and come up with those questions. What is healthcare? What are we looking at? What are the challenges? What are the key takeaways? What are some of the end game results that we'd like to see to?
I was just
Yeah.
checking in on that
Yeah,
comment.
no,
Invoke
we have no
change is-
agenda.
Invoke
No.
change is
Yeah.
a very specific
Yeah.
view shed.
Yeah, I guess what we're just trying to say is, like she said, we don't want a report to just collect dust. We want it to actually move community to better healthcare.
I think just adding to Adam's point, and just something that I think is really important to share with you guys is, part of what LAFCO does is we have to inform and provide good information to the public. And so this is what the biggest goal is with this document, is we want it to be informative, right? We want the public to understand how these healthcare districts work. And, that's essentially at least my goal with this project, is to make sure that that's done.
Appreciate it, Jeff. So, this is all very interesting. I would invite, if you haven't read it, the 2015.
Yeah.
Municipal review. Well done, very comprehensive, very complimentary of each of the healthcare districts. I think the key is here though, is because with all due respect to LAFCO, healthcare districts is a recent phenomenon. That they've historically been involved with water districts, sewer districts, on the special district side.
Yeah.
And cities and mergers and acquisition, basically boundary changes and things like that. And they are clueless when it comes to healthcare districts. But having said that, that was very well done municipal review in 2015. I think the key is, and what I would say to you, is you need to reach out to each of the districts and get their story so that you have a better understanding, because it's a whole different ballgame, even from 2015. Because you're gonna have two districts if things go as planned. You're gonna have two more districts. You're gonna have Fallbrook and you're gonna have Tri-City that's no longer gonna be operating hospitals. But the key is what did they do? Well, in the case of Grossmont, in 1991, they leased their hospital for 30 years to Sharp. And then in 2014, they extended that lease for an additional 30 years. So they're you know, the district had the power, if you will, authority to do that. Similarly, Tri-City is going through that right now, because the days of a freestanding acute care hospital are truly numbered. Okay, and I don't care whether it's Palomar, it's the last one standing. And they're gonna have to affiliate at some point, whether it's with Scripps, Sharp, or whomever, in order to survive. But what you need to be able to capture in this municipal review is the relevancy of districts that no longer are specifically providing a hospital, operating a hospital. And there's a lot of valuable things that we've learned over the last 30 years.
Yeah.
And are trying to do to provide support to the community and ensure that there's access to healthcare and all these things and you need to hear that story. And the best way to hear that story is to be talking to the CEOs and the people of those districts.
Yeah.
And that way your report will reflect properly what's going on, so that it won't be a hit job, so to speak.
Yeah.
And it won't turn political.
Yeah.
But everybody's trying, I can just tell you I represent 3 of the 4, okay? And we're all trying really hard to do what they can with the resources they have to provide to the community healthcare and access to healthcare and improve healthcare for the community. So there's great stories out there, but you gotta, when you're doing your data gathering and all that stuff, that's where you gotta have the connection with the districts so that you understand what they're doing and how they've evolved.
Yeah, all your points are well noted, and that's why we're here to forge a relationship for you guys to help us more than anything. And Rachel and I have been in communication. We've met a couple times, and so we hope that is standing throughout the process. And so, and I'd add one other thing, if you want to entertain yourselves, the 2015 report is good. Read the 2021 report on the resource conservation districts.
Okay,
They're not the healthcare districts,
yeah,
but you'll see how much more comprehensive that MSR is than the 2015 healthcare one. And I bring it up as notice because this past year, well, that was the resource conservation MSR was concluded in 2021. This past year, one of the takeaways from that report was they were having some of the commonality challenges the healthcare world has. Hey, you're providing services outside your districts and your regions and your boundaries. Just as healthcare, the Fallbrook Mission RCD specializes in ag. Upper San Luis Way specializes in water. The Greater San Diego specializes in fire. They all have their unique characteristics. And long story short is we put an ad hoc committee together to look at that MSR and say, okay, let's take some of the takeaways from that report and how can we get to invoke some real change to those 3 districts. What it resulted into is a giant memorandum of understanding between the 3 districts, and there's harmony now. They're working together, they're applying applications together, they're doing financial grants and resources and collaborating, and so it's a great accomplishment. The commission, has received a letter of commendation, and it's a real world example of our rule coming to a fruition to a successful outcome. And I would entertain you guys to look at that MSR because I think we can find some commonalities to that process. Yes, I know the healthcare world is completely different, but we can draw off of that.
Anything from staff? No. I just one comment. I would just kind of piggyback on Director Jeffries about the healthcare districts as a whole. Obviously, they're pretty unique. I think if you look at a lot of the other districts, water districts provide water and, you know, fire districts prevent fire and they're all pretty standard.
Yeah.
Versus like, you know, obviously like all the healthcare districts are providing some sort of services in the community and they all impact the community a little bit differently. So, it'll be really critical for us to provide that narrative, and if there's anything we can do to help out with that or provide any sort of resources, definitely looking forward to the whole process and appreciate you guys coming out and answering our questions. So
Yeah,
thank
we
you.
understand the unique challenges and we look forward to continue working with you to satisfy those concerns.
I appreciate that. Thank you.
Thank you.
Thanks again for coming out.
Thanks for having us.
Yeah, yeah. Okay. So. Thank you. All right, so, next we have, the consent items. Would anybody like to pull one of the consent items for further review? No. Can I get a motion to approve?
I so move.
I'll second that.
Any discussion? I'll just make a comment, on the grant impact reports. I just wanted to say it's really nice to look through those as a board member. I think that, that's a good way of kind of assessing, where the grant recipients are as far as, utilizing those funds and kind of seeing, the impact that that makes. So, appreciate you putting that in there and, definitely, glad to review that for sure.
Ready for vote? Director Leach,
Hi.
Director Stanitek.
Aye.
Director Brown,
Aye.
Director Jeffries.
Aye.
Thank you.
Next we'll move to our action items. We have F1, we have Site Logic. I see you guys come back out, for us again. We appreciate it.
Yeah,
So, if you'd like,
nobody is needed.
yeah,
Sorry.
not sure if you have a,
Well, it's tough to see the numbers. You all had it in your portal.
yeah, I have it, right here.
You try and pull it up on the screen. You. Graphical.
Or you're just trying to bring up that revised one, yeah, okay.
Yeah.
Well, obviously, we revised some of those numbers. I'm not sure if there's anything you'd like to speak to kind of before we kind of get into the discussion or.
First, good evening. Thank you, community. Appreciate allowing us all come back a couple weeks later. Great questions that we received after we left, and I hope Jonathan was able to get all those answers or all those questions answered. We're back here tonight. If there's anything still outstanding, we'd like to go through it. But we really sharpened our pencil. Really wanted to bring a final number to the table. So if you said, hey, if we went into contract, what's the next steps? We're not coming back anymore. We wanted to better understand and bring to your attention, really the scope of that parking lot, and more of the technical background and the breakdowns. So we're ready, we're excited. We'd love to again answer any outstanding questions and kind of tell you how the next steps would look like if there's still an interest moving forward.
I appreciate that. Rachel, can you maybe just speak to the email that you sent regarding other cost estimates and kind of some of that before we kind of get into a discussion on.
Sure. Based on the last meeting, there were some questions to make sure that we were doing our due diligence to make sure the costs were aligned with outside sources if we were to try and a la carte just the parking lot. So that was the focus of that. We went back and looked and tried to dissect some of those same costs from Taylor Design, which had been our architectural firm and we had done some work with. Their cost for just some of the asphalt and such, obviously you couldn't parse out a lot of the additional grading, slope work, oversight, a lot of the other pieces, but their costs probably would have been fairly consistent, if not a little higher than what we could perceive from the performa. We also went back with a previous consultant we've worked with, Rob Holmes, who's helped us with this parking lot as well as our sidewalk project. I was able to walk through some things with him. I sent you some additional questions regarding thickness of the asphalt. Basically, after conferring with Rob Holmes again. Rob was looking at this number as being 100% online with what we find in the marketplace. So he was more than satisfied with looking at that. To be honest with you, Rob was actually more complimentary to the fact that you've added in a lot of things here, especially, you know, some of the detail on the striping and the curbing that he didn't have in his estimate that would have upped the expected cost that he got. So he was complimentary to that. Regarding the EV charging, oh god, that's a mess trying to figure that out in the real world. So Judith spent quite a bit of time pretending as though we were just gonna go out and get EV charging on our own. What do those systems cost? And the variability was wide and deep. And basically all of them came back with, oh yeah, we can sell you something, but you'll have to do all of your own infrastructure and you'll have to do all of your own permitting. And we will give you this wild, crazy potential range of costs. So there wasn't a really good way to do apple to apple comparisons for that. But basically from what we found, those costs would have exceeded, I think, what we're seeing here from that a la carte style menu.
Thank you. Any discussion, comments?
With regard to the EV charging, you know, I sat in on the San Diego County's 5-year plan, capital plan. And part of that plan included the county's expectation to provide up to 500 charging stations throughout the county. And looking at our basic area of the Fallbrook district, I think I counted 6 or 7, maybe 8 actual charging units within our area. So we'd be adding 6. I think this proposes to add 6 charging stations, which is fine. I guess my point is, since our EV allowance here, our plan is about 125,000. Would we be able to partner with the county in some manner or fashion to help add our 6 to their 500 and get them to help offset some of that expense?
And we're anticipating some county involvement and
More than permits.
more than permits.
Yeah.
And we've, you know, we put a placeholder. We don't know what number to put in there yet. Because after we get good direction here, then we could sit down with the county. And here's what we want to do, help us. And we have a placeholder, they're just X's, but we anticipate the county would come to the table and support this project. Either providing the chargers themselves, or providing some further incentive money.
Perfect.
But I do believe coming to the county with the plan, with the support of this board, because they really need to get off go. And I think we're gonna be able to, at least for 6, say, we're ready, we know where they're gonna go, we just need some help.
Gotcha. It may be a spit in the ocean as far as the overall scheme of things, but it's something.
Yeah.
If I can add to that, I oversee everything from Ventura County to Imperial County, and actually that's one of the #1 things we're noticing is neighboring agency support. How is the state creating the new gas card within public agencies when they're being dispatched to other areas? How does the local legislators get involved, especially with redistricting in multiple counties now that they have? We are seeing it all come together, but like you said, it's how do you take this vision, and once they start seeing action moving, then they'll start, you know, beating at the drum to help as much as they can.
Okay.
I think maybe we could ask, I don't know if we could talk to Supervisor Desmond and maybe see if there's anything they could kick back as well. I don't know.
Yeah, again, to Jonathan's point, until we can come to them and say, this is the plan. Again, you know, we still have to go through public hearing, and I think once we get to public hearing point, getting Supervisor Desmond's, support, I do not think will be a difficult plan. He's very supportive of a lot of the things that we've done out here. We had a great meeting with some of his team, the county team last night regarding, some of the behavioral and mental health needs. The county is very excited to see some of the big changes that are coming to Fallbrook. Fallbrook, the word has been a big radar in San Diego recently.
Yeah.
So I have no doubt, that would probably be a good person to be able to count on bringing this forward.
For sure.
You know, I just, my 2 cents, you know, looking at the numbers, I think, the biggest thing for me is just kind of looking at the cost of the project versus the potential for, utility cost avoidance. Right? I mean, I think at the end of the day, like the parking lot's something we need to get done, right? I mean, I think that, we all need to get that done. But this project as a whole, to me, I just kind of look at the utility cost avoidance and the cost of the project. And I kind of look at it as, do we want to have the solar panels and do we want to kind of prepay for that energy investment? And is that something that we're looking to do, you know, moving forward, or is it not? You know, I mean, I think if we look at the numbers for what they are, and if we take staff's word for it, that's the cost. I mean, I think that the escalations that these guys put in, the 5%, I mean, that's pretty low considering how the costs are actually going up, you know, across the board in utilities. So, I mean, I think that looks all fair. I think that some of the stuff like the EV charging revenue, I mean, that's, to me, it's like, you know, it is what it is. Like, I wouldn't want to get into a position where we're kind of competing or like, you know, yeah, counting on that money to offset it. I mean, it is what it is. It's a service.
It's a way to encourage people to come on to our property to
Yeah.
participate in our services.
And that's
It's
the
not
calling
really a-
card.
Yeah, it's not a revenue center for us by any means. We'll take it if we can get it, but
Yeah, but I think if you look at the numbers and you kind of look at just the cost for the utilities and what the project costs. I think to me, it's a, you know, fair cost. I mean, it looks like it's right in line with, yeah, paying for our project with the future cost for the utilities. I like the idea of potentially reaching out to the county and other possible funders to try to get anything that we can get out of it. Like you say, it might be a drop in the bucket, but even if it's a few $1,000s, I mean, every little bit definitely helps. And it definitely seems like there's a lot of money out there for projects like this. Although I did see that they were already trying to pull back some of that money. So, you know, I'm not sure what the future will be of some of that Green New Deal money that's out there, whatever, but, you know, I think to me, it looks like a responsible project. I'd like to move forward with the parking lot and kind of, you know, move forward with the project. So I'll leave it up to the board. If somebody would like to, you know, make any other comments or make a motion, I'd certainly be welcome to that.
I'm so, I think it's a legacy project because look at how many years will be enriched by our decision on this. And they can look back on it and know that whatever they're doing can enrich. So I think it's a generative project. And is it appropriate for a motion or an emotion or something?
I mean, I think we have to go to a public meeting. I'm not sure what the motion would be, just kind of proceeding, or I'm not sure.
Yeah,
It's on for
essentially the motion
for
would
action.
to move forward to the next step with the public hearing.
I so move.
I don't second that.
Okay, any further discussion on that?
I just agree with you. I think these numbers are much more indicative of reality in terms of true cost, true revenue opportunity. You take out solar, you take out the energy avoidance, you know, it didn't respect your parking lot conversation. So this does make better sense in seeing the sensitivity and pulling some of these other things out that were, who knows, right? Assumptions. This feels a little tighter and feel much more comfortable with it as well.
Yeah. Well, with that, I thank you guys again for, presenting to us and answering a lot of the questions that we had. You know, we're definitely aboard with a lot of questions and definitely care.
It's actually
That's a
refreshing.
stop now.
The
Yeah.
questions that we received, this dialogue, you don't always see that. And sometimes I wonder, you know, is there some thought behind this? And so we appreciate the questions and the dialogue.
Okay, thank you.
We're just trying to get a parking lot.
Paradise.
Before we move to a vote, do we have any public comments on this issue? Nothing? Okay, whenever you're ready.
Director Brown,
Aye.
Director Stanisek.
Aye.
Director Leach.
Aye.
Director Jeffries.
Aye.
Thank you.
All right. Thank you, everyone.
Thanks a lot.
Thank
We
you, guys.
appreciate
Thank
it.
you.
Looking forward to working with you guys.
All right, so we'll work on getting that December 14th
Yes.
public hearing date. potential.
14th or 13th?
I don't
Wednesday or
remember,
Thursday?
something like that.
Wednesday. right?
Wednesday.
Yeah, 13th.
Wednesday,
Yes.
Wednesday.
The fact that you can think that date a month in advance sounds awesome.
I'm already planning September of next year.
Terrifying.
Thank you.
And I know
Yes,
she is planning June.
December 13th, perfect.
Yes.
All right, I'll be in touch.
Thank
Thank
you.
you.
Next action item, we have F2, the California Class Cal Trust transfer update. Terry?
So, at the finance committee, we had some discussions and we got some news. A report from staff that indicated that if we go through with our $3 million transfer from Cal Trust to California Class, we would be experiencing about a $16,000 realized loss. And it would take us several months to break even on that, cover that loss. So staff was kind enough to arrange a Zoom conference call with California, Cal Trust, and they gave us some options and some very good suggestions. So your finance committee would like to suggest, and I think, did you have a chance to kind of write up a proposed?
Yeah, it's on your agenda. It's on the second page if you had that printed out, but yeah.
So what we're proposing to do is to reallocate $1 million within our Cal Trust holdings from medium term to a liquidity fund of theirs, which would essentially still allow us when we're ready to do our transfer to minimize that loss down to like less than $1,000, as I understand it. Okay, as I was listening, that was my understanding. So if you have. Yeah, mine's kind of cut off at the top. Basically, we're recommending that we keep the funds within Cal Trust and not transfer to Cal Class at this particular time, but instead transfer just $1 million within Cal Trust from a medium-term fund to the liquidity fund. And that will then, when we're ready to transfer, offset whatever our loss might be.
Is there a timeframe or a checkpoint that would say that we change that decision at that point, or depending on the market and where things are flying right now?
Obviously, it will depend upon the fluidity of the market.
Right.
And we'll track it from month to month over the next couple, 3 months. And then at the point in time where the numbers look right, then we'll go ahead and recommend that we do the transfer.
If the money is in the liquidity fund, is there any like early termination penalty, or is it at that point we're fine to transfer whenever we want?
That's a good question. I don't have an answer to that. My sense of it is that Cal Trust would have told us if there was a penalty, and I did not hear them say that. But maybe we could have staff just double check.
It primarily goes back to whether or not we would go to the same point of, is there realized losses or unrealized losses, realized gains, unrealized gains? The expectation with the liquidity fund is because it is much shorter term, you don't have those same kinds of challenges. The nice part about the liquidity fund, the reason we're talking about this transfer is so that we can capture this higher yield of this unique market time.
Yeah.
So there really isn't, we're not really talking about taking the funds out and
Yeah.
using them as cash, but really whether or not we would leave them in this liquidity or transfer them back into the medium fund. The expectation is that we're not gonna wipe that fund out for a large capital improvement project anytime soon. So it would primarily stay in that investment portfolio.
Understood. Is there a difference in the interest rate in the two accounts?
Yes, and that's where we'll be making up the difference,
Okay.
on our potential realized loss to minimize that effect. Little higher risk because it is a higher return, but that's CalTrust, and I think we have a comfort level with CalTrust.
Yeah, and that's all within the parameters of the financials for the state, yeah. Okay, well, seems fair and reasonable to me. Would you like to make a motion to that effect?
I would like to make that motion as it is written on the back. That we recommend that we keep our funds within CalTrust. And I assume that will we need to address that motion and approve the motion that we have for the $3 million transfer, which we will not be executing at this point?
I think you can just take this action, will satisfy that.
Okay.
That'll supersede it.
Recommend that we keep the funds within CalTrust. And we transfer $1 million from the medium fund to liquidity fund.
I'll second that.
Within CalTrust.
Any discussion? Okay.
Director Jeffries,
Aye.
Director Leach,
Aye.
Director Stanisek,
Thank you.
Director Brown.
Aye.
Thank you.
Thank you. I appreciate your careful care of the district's money, for sure. So moving on to some discussion items, I guess we just have one here, but it'll take us some time, I'm sure. So obviously we've been discussing the district strategic plan. It's been a big topic with staff and board members here the last month or two. So we have just a discussion, open discussion. We have some comments here, some different things that board members sent in. But I would just kind of open it up and, if you guys want to, we can go in order. If you guys want to just kind of put out some of your priorities and your thoughts, and then we can kind of go from there. I'll open it up. What would like to make comments?
Well, for me, I guess it's, the 1-3-5 is kind of where my brain sits all the time. 1 year, 3 year, 5 year. And for the 1 year, obviously, we have the wellness center project, that's key. And bringing that out at appropriate level of speed. 3 years, it's a couple of things. It's effectiveness of current programs, doing some grading of kind of where we think things are doing, the impact they're having, and doing a review on those. Secondarily would be kind of the next level, the MOU discussions that we're having and how we transition from grant to MOU partners. It's kind of in that window. It goes on every year, but I think there's a broader goal potentially of company and that we may want to target out there in 3 years. And then 5 years for me is all the age-old questions of urgent care, hospital, true medical care in the facility, in the district. And what is our vision for that?
Yeah.
Do we have a plan to specifically, very simple statement, we will have an urgent care in 5 years.
Yeah.
I know that's right with lots of fun discussion, but those are the kind of the buckets that I've kind of looked at. And I think those are the big ones. And I think from a strategic planning process, you've got to keep these buckets pretty simple, but deep. And so that's where I'm at right now. 1-3-5, what are they?
So yeah, I guess I'll go next. I've actually had definitely a lot of thoughts about this whole plan. And I think that, where we are in a timeline, having just finished our vision and values, and a lot of that discussion kind of puts us right in line for, this type of discussion. So
really glad to have it. I think that, like I mentioned previously, I think that the last strategic plan was more tactical and more just kind of like a work plan. Definitely looking for greater goals for the district. You know, I wrote down a couple just as an example to think about. I'm sure there will be a lot of them out there, but the first one for me was to make the wellness center a hub, a community hub for health and wellness. I think that the wellness property to me is a big part of it, you know, I mean, you know, but I'm not trying to like come up with a goal, have the roof done by March, you know, I think that you know, for us to set a goal of that being a hub for the community and, you know, somewhere where we can do a lot of things, kind of leaves it open for staff to kind of come up with different programs to fill that in. And then I had another one that was kind of went into our mission statement to, you know, as far as being a California recognized district, and that was to become the district of the year or receive some sort of distinction from a statewide organization like CSDA or ACHD. I think that a goal like that would lead to a number of different tactical elements and training for the staff, training for board members. I think that, you know, another part of it was saying that we have highly trained staff. I think that a goal like that would kind of be in line with something like that. And then I had two that were basically just, I guess, maybe goals for community type education. And one of them was, I just kind of threw out this number, but train 5,000 residents in CPR. You know, I think like a goal like that, you know, or a thought, you know, how can we impact health in the community? What sort of things can we actually do that 5 years down the road, we can say, oh, that did something, that helped somebody, this helped, this did something. And the other one's kind of in that same area is maybe provide AEDs in high areas of need, or look at that, you know, that issue. Again, another one where it's just looking at what are the areas that we can actually physically improve health, and again, kind of some goals that you know, the staff can look at and say, hey, we trained 1,000 people this year, and you know, where are we at as far as our goals? I think that having goals like that is definitely important for us as a board to kind of go back and look at when we do stuff like the CEO evaluation. And you know, I'm sure again for Rachel evaluating staff, for us to be able to look at goals that we set strategically and actual numbers and say, hey, where are we at on those goals? Are they accomplished or are they not? They're not vague. They're, you know, this is kind of where we're at. So that was my thoughts. You know, I think that it's ongoing discussion. You know, I'm definitely thinking that as a board, we all just need to kind of think and, you know, discuss and kind of figure out where we're at. But those were kind of my thoughts, and, you know, so.
Yes. Yes, I'm rowing with you on that. For speaking of buckets that are deep, yeah. So clinical services and program priorities ring bells for me, because I think that's the pebble in the pond that radiates out, and you do get to capture data around that. So a strategic plan that has a focus on those two categories, I think would be a strong one for us. And in light of the review we're going to be having, it will be good for them to see our forward manifestation of the vision. I think also we're just a buzz related to our facilities there. I mean, the community just knows we're there. So tending to that, which we took a big step tonight, the aesthetics and the utility of our facilities. I think we're off to a great start, and let's keep pushing on that. So those would be my 3 lanes: clinical, program, facilities. And much of what you said, it's right.
Yeah, no, I think that there's a lot of good things that we can definitely do out there for sure. Jerry?
Yeah, I'm just feeling that, with regard to Jennifer, our clinical services are really, to my mind, where we are at. Pardon my daily participle. But, we don't have to my mind, really an effective urgent care center in our area. That's why I've been such an advocate for our partnership with North County Fire. In that ambulance that we gave to them, I was thrilled with that. You know, I would do that all day long. Those are nothing more than mobile ER rooms. If we can't have a hospital with an ER, at least put a couple of those out there.
Yeah.
That, to my mind, really serves our community right where the rubber hits the road, when they're sick and they need help.
And if I may, I'm realizing perhaps Barbara and I, and Rachel met with our Tri-City partners on the current MOU we have with them. And that was a very centered meeting. They are interested in what they might do in the area of clinical services for this area. Now, their partnership with UCSD may even open them up even more, because a load is going to be lifted off of them, this constant precipice that they've been on, I may say so. And so I think there are some real seeds we can plant there and continue to grow them. The urgent care is so locked into the market. I mean, we had the survey that was done. They looked at us and said, see you in 10 years if you build out. So I'd want to be careful about the manifest or the description of what clinical services look like, because there's a lot beyond our control. We don't have enough calls, you know, in the dead of night, and we got that data from North County Fire. So what I think clinical services is a good place for us to start and build out from there as much as we can, given the market factors, because we don't have data that says we're viable.
So reflecting what you're saying there, in my mind, what I'm hearing there is engaging with the partners, Tri-City, UCSD, to expand service offerings in the clinical services area, not necessarily owning them, but expanding them through the opportunities of leverage with them. Yeah, I think that's an interesting 1 to 3.
Yeah.
Yeah, but you know, talking about urgent care centers, and this fellow next door here, my experience with urgent care centers as an employer, which I've been on the receiving end for a large number of employees. Every employer in the state of California is required to have an effective employee health plan. And if an employee gets injured on the job, they get to go to the local either ER or urgent care center. What that means is that every employer who has the insurance to be able to cover those employees when they get injured needs to have an arrangement with the local either ER or urgent care center. There's got to be a bunch of employers here within our area that certainly have more than 3 or 4 employees, because those people would be required to have some kind of place to go, and it's got to be posted in their place of business. I'm sure we do here. Don't we have one of those big posters that has all the stuff, and it says, where do we send our associates if they get injured on the job?
So if you're talking about workman's comp primarily.
Exactly.
Right, so obviously, because we are a different size team for, we'll start with the ER part, because that's the easiest part of the answer. Because we know each other's health plans, depending where their medical home is, we may either send to Palomar, Tri-City, or to Temecula Valley. If it is 3 o'clock in the afternoon, I'm not sending anybody to Temecula Valley. It's just too hard physically to get there, just due to timing, right? And North County Fire would probably make that call if it's an ER related. If it is a workplace problem, they may have the opportunity to see their primary physician, or we can dictate. We don't have to be contracted with any of the urgent cares. Again, there's urgent care in Oceanside that has extended hours and an urgent care in Temecula. So we probably look at either one, and we can determine which one to send to based on what happens with that employee right then.
So to that point, the other employers in the area probably got a similar type of.
Yeah. Other than the larger employees, which are going to be like McDaniels, maybe Del Rey, obviously, Rainbow, the bigger, the school districts. Their arrangements are going to be very different from ours because they are gonna have union staff, they're gonna have some different protocols. But as far as other small businesses, we might wanna do a survey to see what other employers are doing, because I don't have that knowledge.
I guess what I'm driving at is I think that there's a market out there talking about a 5-year plan that would more help justify an urgent care center.
Oh,
It isn't just the kid falling off his bicycle and needing to go to an urgent care. I can't tell you how many hundreds of thousands of dollars that I have seen my company, me, pay to workers' comp to take care of my employees. And having an arrangement with a good quality urgent care center that understood the finesse of making sure the employee was taken care of, but not necessarily giving them a pass to be able to be off of work for a month or whatever unnecessarily. And to the selection of where the employee would go for services, the employer is the driver. In that case, the employee belongs to the employer, and the employee needs to go to our selection first, so that we can screen that employee, make sure that they have a plan, they're gonna get the care that they need. If the employee wants to go to their own healthcare provider subsequent to that and use their health plan for that, they can do that. But there is our workers' comp doesn't want us to do that. They want us to retain control of that employee and their episode that they're dealing with. I'm just trying to tell you that I think as far as urgent care center, that's our book of business as a healthcare district.
Yeah.
And I think that it is there for us to have in our 5-year plan because we can justify it. Like I said, how many ever studies that you did trying to find out how many kids fell off their bicycle and had whatever, that's not where the book of business is, in my estimation. We would be providing that service through our own resources, plus it would be a revenue generator, just like the hospital was, hopefully better than what the hospital was. But to my mind, that's what our core business is providing healthcare service for our community to the extent that we can.
Yeah.
We don't have a hospital, but we can do it in a lot of different ways. But an urgent care center ought to be at the top of our list. Or notwithstanding this guy next door.
Right, or a description of the services that we need to provide in the next 5 years. However, the best channel for that, right?
Works for me,
Yeah.
you bet. You bet.
I think on that, I think it's important for us to kind of be, I don't want to say like vague in our wording about looking for opportunities for partnerships or something, because I think like Director Jeffries was mentioning, like this meeting with Tri-City, it's kind of like, well, maybe they'll offer us some good deal, or there might be other people.
I would expect Tri-City to jump on that, since we really don't have a healthcare provider big time out here in this part of the county.
Yeah. But I think, the biggest thing is for us to be able to be open to potential opportunities. I think that another big opportunity out there on the urgent care front is something that's been talked about in the legislature for a couple of years, and that's allowing some of the ambulances to deliver non-urgent people to urgent cares. I mean, I think that if that were to pass and we had an urgent care with a partnership, I mean, something like that could probably be pretty effective. I think that's a huge priority, some sort of clinical services. I'm not sure what that looks like, but us to be able to say, hey, we're, we're looking at doing that as a goal, because I think that it's been a discussion. I mean, I think that, I think it'll continue to be a discussion until we figure out like what that looks like. We've discussed with like the PACE program and different things like that, and I think that there's a lot of different potential opportunities out there, and especially with a lot of the different money coming in from the different, universities and whatnot right now, so, do we, know, Rachel, or do you have any information about any, districts that are currently operating, urgent cares or nothing? Maybe we can get like,
There's a few that operate clinics more like a FQHC,
okay,
but whether or not anybody operates in urgent care, I don't know. We can obviously follow up with ACHG to see if there's any additional knowledge.
yeah, that'd be good. I mean, the more information, Jeff, yeah.
Yeah, I think the threshold question is you gotta decide what you wanna be when you grow up, so to speak. And so for a board, you have to determine whether or not you wanna be supporting the creation of an urgent care clinic. And whether or not you wanna be supporting it or actually running it. And those are much more complicated when you start to get into the running business. That's why it might be an opportunity if you can affiliate with somebody that has the expertise, that has the ability to do it, and partner with them, because what you're trying to do is provide the service to, the bottom line is to provide the service to the community. But getting into that business, I think you have to take that, you have to look at that very seriously. And I think you want to try to, what you've done historically and what districts that no longer are operating hospitals in general do is they're looking at organizations, whether they're nonprofit organizations or an affiliation with a public agency, to be able to that are in that business to operate it, as opposed and help the financial aspects of that and get that success that way, rather than getting into that business. Because once you get into that business, I'm just telling you that there's a lot of, I think it's a more complicated role for you.
Yeah.
And
I think there's a lot of unknowns in running the business or whatever. I would definitely agree with that.
I don't think the end zone is we needed urgent care. I think we need an affiliation partnership or process that's working in this ever-changing environment to deliver X number of services to the community. And that X is defined by, 80% of it is lacerations, or I don't know what it is. I mean, I'm sure there's plenty of studies on where you cut the pie in terms of what we would be looking to deliver. And then the second part of that is the channel of delivery, whether it be partnership, affiliations, or a new model that doesn't exist that we don't know about today. There could be a new model we develop. Who knows?
Yeah.
I'm open to that.
Yeah. So yeah, I mean, maybe if we could get just more information on any potential partnerships or clinical services that any of the districts are doing, it'd probably be a good idea to kind of look at some of that and see. But I definitely think that as far as a strategic plan, the idea of us partnering with somebody and providing health services is critical. I mean, especially with the LAFCO coming and discussing how they see healthcare districts and collaboration being a big part of it. I mean, I think like Jeff said, it doesn't matter to us like who runs it, as long as we're able to provide those services to the community. So, I think that that's definitely an ongoing discussion and, needs to continue to be an ongoing discussion as far as, that goes. So I'm not sure how to potentially word that in a strategic plan, other than just kind of say like,
Research clinical services.
yeah.
I mean, and we can probably tailor down with the goal to bring as yet unidentified medical care services to the community. And then we can outline and detail that a little more as we get more information from these opportunities.
But if we do it like that though, too, I'd like, it to be like a set, like 5 years, like we're set on like figuring that out and, as a work plan, every year, every quarter, what are we doing towards that? Where are we getting, like, what sort of partnerships, where are we at? I would hate to kind of put it as like a 5-year objective that just kind of is out there, whatever.
I agree. I don't want it to be like that. And I'm not necessarily suggesting that we go into the business bricks and mortar wise, because I understand Jeff's point, I agree with that. But, with a partnership, if it be with Tri-City to provide those additional services to our area, that's really what I think that our obligation is.
Yeah.
Is to do. And I guess one of the questions would be with regard to Tri-City and whatever they're doing with UCSD. Is UCSD, are they an HMO of some sort
No,
additionally?
it's a, like, okay, so that's
The million dollar.
or rather, University San Diego Health is, if you will, a subsidiary unit of the Regents of the state of California. Their budget's 50 billion a year. Now that includes the colleges, but their emphasis right now, it's the number 1 hospital in the county. It's the number 5 hospital in the state. It's in the top 10 or 20. It's like having Johns Hopkins affiliate, but it's a public agency similar to the district in the sense they're not a non-profit in the sense that they're backed by the state of California. So they look at patient care as the number 1 priority. They're not necessarily thinking, well, if we lose money, it's the end of the world. They have that luxury. So they're looking at what they can do to help enhance healthcare in these communities that they're reaching out to. So now they've gone up to Alvarado, bought Alvarado in East County, $200 million. Now they've gone over to Tri-City. We got a lot of work to do to get that completed, but we're hoping to get that done by March of next year. If that's done, then the CEO is looking where else, we want to reach out to the community. And so I foresee that there would be opportunities to reach out to even the Fallbrook community as they just move around, as they move up, and they're looking at clinics, and I'm sure that they'd be open to urgent care situations and whatever, so the opportunities is there. Now, it's not going to happen in the next 6 months, but it is something that's where they're at. But their structure is basically a public agency, and what they're going to do is enter into a joint powers agreement, just like we've entered into a joint powers agreement with Tri-City. They're going to enter into a joint powers agreement with District Hospital. They're going to operate. They're transferring all the assets from of the improvements and all of the assets of the district, the hospital related campus and other facilities that Tri-City owns. And then then San Diego Health is basically going to have the responsibility for operating those facilities and assuming the debt and the obligations and the seismic requirements and all of the things, the bundle of obligations that are massive.
Essentially a triple net arrangement where they're gonna take over everything?
It's not, we started out looking at it as a lease, but as I looked at it, it looked to me to be more advantageous because there's a lot of restrictions in the health and safety code when you lease and transfer assets from a district to a nonprofit, for example, or even to a for-profit. So this was a better model to look at a JPA so that that gives us the flexibility to basically do anything we want. But the bottom line is they will then become and assume the responsibility for operating that hospital. And then the district will still have its tax revenues just like this district, and it'll still be providing services to the community similar to what this district is doing. And that'll take a little bit of time to get rolling, but that's what the plan is.
So what I heard in all that is a potential strategic objective of we need to get to know the business development side of this, better lack of a better term, organization, and see how we can influence potentially the delivery or funding. And I don't know how to do that, but it feels like there's a partnership there that
Well, and I think
we need to accelerate and formalize.
as that is completed, they're going to be very open to seeing what else, other opportunities with other district hospitals
Yeah.
are gonna be.
Yeah, I'm just
So,
saying, we need to be making noise there.
yeah,
So
we've had an initial meeting with them and their CEO, yeah, so we're kind
That's what I'm
of,
saying.
we're kind of shoehorning ourselves.
It's a great
in there
opportunity.
where we can.
Yeah. Well, and in the meeting, it got as granular as thinking about the 76 and where
Yeah.
Tri-City might plot themselves.
Right.
I mean, their ears and eyes were,
Yeah, they gave us like
very
potential
interested.
rental areas and everything,
Yeah.
so they're definitely, thinking and, I mean.
We're
it's
on
good
their
for us to
radar.
explore
And,
that
and I
for
have
sure.
a follow-up conversation that has been ongoing with Dr. Ma, who's the CEO at Tri-City for now, and how that partnership will work with UCSD. Obviously, I've spoken with Jeff as well. We are investigating what it looks like, knowing that obviously they have to figure out what their partnership will look like before we can address that. But for us to continually be a reminder to them that we would be a very strong, supportive partner for them to provide those expanded medical clinical services. Keep in mind that UCSD Health Services is already moving into Riverside County. It's already in Temecula.
Yeah.
We are a natural progression of that service line.
And for what it's worth, I had that specific conversation with the CEO, and she said the same thing. She says, we're already moving into Riverside.
Yeah.
So, I mean, it's.
So whether that's a 1 year or a 3 year goal, it just feels like, that seems like some action and work there that we have to call out.
Mhm.
How to exactly describe that, but
Yeah.
ride the wind, man.
Right, the wind. That's the goal, right? The
And it really does fit into their scheme. I mean, it's just a natural progression up there. So, I mean,
So what is their footprint going to be in Riverside, in Temecula?
It's already there. They have a partnership with Rancho Family Medical to provide some clinical as well as supporting their urgent care program.
Okay.
The urgent care is still listed as Rancho Family Medical, but right below it, it says UC San Diego Health.
Okay.
And that's just the Temecula side that I know because I drive by it every single day.
Clear the smoke.
Very slow.
Well, there's not, we got more smoke here in Fallbrook from that fire in Awanga than Temecula did for the most part.
Ride the wind.
Yeah.
It did.
Do we have any staff comments on the strategic plan or any of the ideas? I'm willing to take any thoughts and ideas,
Anything we
you guys
missed?
got, yeah.
They've all sent me many little emails, but really, if you'll all let me encapsulate the conversation. Okay. There's a lot of conversation really about making sure that we have a goal for the team to be able to work towards, which really has more to do around the programming benchmarks, right? And then there's logistics around that. The primary being, obviously, we have been following the Catalyst recommendations on what were the greatest community service needs. We saw diabetes was number 1. We saw pretty much all things mental health number 2. We have been following that. Obviously, you got to see Bianca and her cheer squad talk about the DPP program, and we're moving that direction. So the idea is we as the team, they as the team primarily, really do want to make sure that the board is seeing that as a long-term investment and plan, right? If that is one of the pillars, buckets, whatever term you'd like to use, that the district is saying we're investing in the importance of health promotion around diabetes care in this community, and knowing that we're not going to be just constantly playing whack-a-mole with programming. Here is a primary objective. Knowing that clinical services and all these other big things are important and we will be researching them. But what are we investing in now that we want to stay investing in?
Yeah.
Or what is just hey, we tried it, it was great, it's done and we're out. And I think the general conversation is we're anticipating that has been a focus. Obviously, our partnership with the J. Moss Skinny Jean Foundation, that whole program is gearing up. We're talking about the second cohort. They're bringing in their Spanish speaking so we can now have a Spanish speaking cohort. How we will expand that. The next part of that is the active diabetes disease management program part. That's another piece that we need to investigate. That's a large investment in district resources.
Yeah.
Not just cash, obviously, but staff time, facility space. If that is an important pillar of what we see, because there was a community needs assessment that showed that that was significant, we do need to make sure that that fits within the strategic plan.
Absolutely.
Did I encapsulate that fairly well, team?
Was there any nuggets that came out from like a 5-year perspective of what does this place look like for us that would be really exciting?
I would say that we didn't do that just yet. We have been kicking this conversation down the road, waiting for you all to decide your objectives.
Yeah.
We didn't want to get excited about have something over here and have you all be like, yeah, wait a minute.
Yeah, we have great ideas, but then we're like, is the board gonna give us a direction before we take off on our own and then?
Well, a large part of that has to do with whatever our mission statement is
Correct.
and the vision
Yeah.
that's there. So that's where we are. Now that we have a good solid mission statement.
I've heard some 3 really, I mean, talk about pillars, buckets, you know how big on that. Programs, good, bad and ugly and new. Wellness center, pearl of the community, expanded programs. What are the next ones in 3 years that are gonna be leading the healthcare charge that are having the most value to the community? Big time program, clinical delivery, 5 years.
Yeah.
How, who and when. You know, those to me are starting to feel like now we're getting some real discussion points. And then you build in the objectives under those based on that each year.
Yeah.
And which ones you're driving towards. So I'm actually excited to hear all this. This is cool.
Yeah, just on that note too, I probably should have mentioned the diabetes prevention already. I think that to me, like that fits kind of under the clinical services area. I mean, it's something that's, you know, something that we're providing for the community. I mean, I would like to provide more, you know, but I think that it's something that for us that we can do now. I mean, I think that, you know, I'm not sure what level of expansion that we're looking to do with that, but I mean, I think that a strategic objective of saying, hey, we'd like to have a certain amount of participants in the program or you know, something along those lines, I think would be good for us to be able to say, like, at the end, hey, we touched 200 people or 400 people, you know what I'm saying, to give you guys some sort of idea of where to go and, you know.
I really appreciate what you said, because I think in the nature of clinical service, as we're talking about clinical service and we're talking about the Community Health and Wellness Center, the programming we have targeted is CDC approved. A lot of these programs are billable. Physicians can, you know, refer people to these programs so that the quality is there. So it's not the clinical care of actually being, you know, doctored too. But the level and the direction that healthcare is going, let's prevent things. Let's deal with some of these lifestyle changes that affect heart health, you know, blood pressure, arthritis, diabetes, all these things. It does, it's something to consider in the direction you want to go, because there is a clinical value to that. Our doctors here in Fallbrook right now have no place to send these patients. So they spend their 15 minutes talking about diabetes self-management for someone that's type 2, and a lot of people need more time. Maybe not everyone can self-educate, but we could provide that, you know, service. So it's kind of like, well, how do we want to define the nature of the clinical services that we provide, which I think goes along with the vision of what we could do here in terms of prevention and stopping some of these things and supporting the community in that way, as well as like immediate direct services. They both have clinical value. So that's kind of some of the, in terms of the vision and the direction, that's, you know, helpful and to keep in mind.
And we've already, I mean, you have all already made some important long-term vision decisions about the health and well-being of this community. Katya is one of them. Obviously having our community resource navigator, we did a very soft open for that position because we wanted her to be able to have time to build up the resources, get the right software in so that we can track that data. We're just now at the point where that software is really going to be able to pull out some reports. So that'll be something that we can bring back to say, strategic priority was to make sure that the overall community health and wellness was being met. Okay, diabetes was one, mental health was an important piece. Obviously, our Palomar Family Counseling Partnership is beginning to address that. We'll start to see some numbers from them next quarter. One of the third parts of that really had to do with a lot of things that talked about our social determinants of health, right? We had a lot of challenges with health literacy. We had a lot of challenges with people not being able to navigate through county resources and such. We identified that quite deeply during COVID. So we designed this position, we've hired this person, we're capturing data. The goal now is to bring the reports back that Katya is getting from these clients to say, these are the kinds of needs that the community is bringing to us. We can identify the health impact of those pretty easily, but these are the issues they're bringing to us. We had a nice conversation with some of our county partners yesterday about what could the county bring here and do more for us. The county are doing these listening sessions about what would you like us to see? Well, Mike was there last night, and I don't think there was any punches pulled.
No.
Where our community members that were there, our partners that are there, the district voices was there of, we don't see you.
Right.
AKA the county. You see us working to try to get you here. And that conversation has to be had. And now we will be able to substantiate all of our concerns, because Katya's numbers come forward and say, people have problems with housing, they're having problems with transportation, they're having problems with food, and they're having all these problems and not being able to access any support through the county. Now, she's not gonna make that argument, because she's much nicer than I am, but I am.
Go get it.
But we'll have the data to be able to back that up.
Yeah.
So when we start talking about programming, diabetes is incredibly important. We're working on it. We've already got it started. Mental health. It's a problem. We found a solution. We've already started working on it. This large conglomeration of health literacy and challenges, we had a problem. We found a solution. We're working on it. We're going to bring that data to you. We also want to make sure that this is a deep, long-term work plan. So I don't want to be able to just say, oh, in 1 year, we only saw 100 people, and have you be like, well, that's done, we're out. Obviously, we know that it's going to be a little bit deeper and longer to unravel some of these challenges. It's a trajectory,
Yes.
right? And we know that we're going to see trends. So when we start talking about that strategic plan and we start talking programs, I think that is the meat that this team is chewing on. Sorry to my vegetarians. That is really where we are working on, is the programs.
Vegetarian.
Do we not have any
We all like
vegetarians? Get a bunch of carnivores.
Carnivores here.
Got a bunch of carnivores.
You know, my request would be to that, and that is awesome. I would just want us to make sure that, maybe we get some numbers on the diabetes program, for example, which I think is awesome. Are we doing any duplication with regard to some of those entities out there that we are supporting through our own dollars? So are we working at our own pot? And I'm thrilled to have us do it. I truly am. Add in the services, add in the people, whatever it takes. But it would not make sense for us then to be turning around and giving dollars to, and I'll use the pantry as an example, because they have their food education program, which ties into diabetes. I get all that. They even said so. So if we're gonna do it, let's get into it and just do it big time.
And to your point, Terry, when we were doing our community needs assessment, some of the original planning around the programming at the Health and Wellness Center, one of the key provisions was, we shall not duplicate, right? If it's being done well by a partner, especially a partner with grant funding, it would be ridiculous for us to embark on it as well.
So do we have a duplication there, for example?
We don't. Actually, we have had multiple conversations with the food pantry, and the programming that they're offering is very complementary to what we're doing, but it's at a much more surface level, I guess is a better description at this point.
We're evidence-based in our clinical reporting and.
Yeah, and so the idea is that they are a great feeder to a much deeper solution. That said, Shay and I are working to get a meeting together. She has some plans that if they get this particular grant through the USDA, they'll be able to expand some of their programming. Great.
Yeah,
That's a perfect MOU for us to be able to help support that we don't have to do.
I'm all good with that. I just want to make sure that whatever we are getting into, I'm okay with that. As long as we aren't duplicating and paying out the dollars to somebody else.
Absolutely.
Yeah, and I like how we're running the program, so keep that up. for sure.
Absolutely.
I think that that's, I mean, as a board member to be able to look at like, hey, what sort of like clinical health, are we doing? Obviously we talk a lot about the grant programs, but it's nice to be able to look and say, hey, we have a program that's actively, promoting health and, doing actual, things out there in the community. And as far as the program, I mean, we're the only diabetes prevention program, and is it North County? Is it the county? Or?
North County.
Okay,
There is
so-
another program, and but it's on tribal land, and it's very specific to very specific demographic and very small number of people impacted.
Understood.
Yeah.
Yeah, no, I think that's a big piece, and just the idea of collaboration. I mean, us being able to collaborate and figure out like any sort of relationships that can benefit the district as a whole, moving forward. But I definitely get what you guys are asking for as far as the depth of plan. Like it'd be nice to give you guys a good plan and give you guys some idea of what's going to go on. And I think that for me, I think that something like that diabetes prevention program is a pretty good, successful program. Just some quick thoughts, just a couple quick ideas too before we kind of move on, but cardiac rehab, I think that's been something that's come up about 1 million times. I've heard it like from people, when the hospital closed, I would say that was probably the biggest complaint from people is that cardiac rehab program. I mean, maybe we could look into that as a potential extension of clinical services. I mean, if there's a need in the community, and that might kind of partner up with diabetes prevention, but I would be interested in trying to find out like what the demand for something like that would be and how, potentially we could work something like that. But again, when we're looking for pieces to try to fill in that clinical bucket there, I mean, like there's definitely like some ideas out there that we can kind of look at and, I would say the two biggest things I've heard since being on the board are urgent care and cardiac rehab. Like probably the second biggest thing I've ever heard about, like from people saying, hey, I'd like to get that done.
Yeah,
So-
you're sitting in what was cardiac rehab,
Yeah.
and everybody wants their treadmills back.
I mean, and it's something like, if it's something that just, I'm not sure all what goes into it, but if it's something that provides a little bit of space and some treadmills and.
Oh,
we
no,
can-
it has to be full RN
Okay.
monitored,
Yeah.
and it's a significant piece.
Yeah.
I had a very, very brief conversation with, Jean, Dr. Ma over at Tri-City, and the fact that their wellness center that, we
Yeah.
reviewed and how it pretty much is not running anymore.
Yeah.
Because it was
Yeah,
such
their
a,
wellness center is kind of like a gym.
Yeah.
I don't know if you guys have taken a look, but it's out in Carlsbad and it's basically like a wellness spa type thing.
and it's a huge
Yeah.
revenue suck.
Yeah.
So that was part of their challenge. So the idea of what's the alternatives? What else could support out here? First of all, we have to find out who our cardiac partners are. And so far, Temecula Valley Cardiology, which is in Bonsall, has been really the only partner, and they, they're a big corporate machine.
Yeah.
They're not real partner oriented. But that doesn't mean we can't continue to try and see how we could support them and come forward with, hey, we may have this potential partner. How could they bring services? And that may help to expand both of those needs.
Yeah, I think that's just another one of those health disparities that we look at, like diabetes or like the mental
Yeah,
health.
well, and
side or
the
whatever, for
hypertension
sure.
is a big
Yeah.
part of that, so.
Yeah,
Yes, as Teresa and I are kind of mind mapping the plans for 2024, we're looking at lifestyle change programming in general, which diabetes is one part of that. We're also looking at heart matters, everything that's cardiac related. Everything from, you know, the program went through the AAH Healthy for Life, which was also suggested through Catalyst. And then we also have, you know, just today I was on the phone with one of our local organizations who's requesting more training in AED and CPR. And that's his third time and, you know, the second time in 2 months that AEDs have come up. And so now my antennas go up. I'm like, okay, like how is it we can, you know, get all the different organizations retrained, make sure all the AEDs that have been, you know, distributed are functioning and they're ready to go for 2024.
And again, through our JPA partnership with North County Fire, right,
Yeah.
we can make that happen.
Easy.
Yeah.
It's getting the AEDs, which there isn't a direct process for yet.
Yeah.
Yeah.
And I mentioned it on my end too, because I've seen some of them out in the community, like at Ingold, where, you know, there's seniors playing softball, somebody could easily get a cardiac event. And I think that the likelihood is that nobody there knows how to use it, like, you know, somebody could die.
Like you said, when was the last time somebody's opened that cabinet to see what's living in the box besides?
For sure, you know, and I had talked to a guy that managed Ingold like 2 managers ago, like back in the day, and he was even saying, yeah, they got it as part of a grant through us. And then the idea was to get some sort of training, and then it just never happened. So, you know, I'm not sure if they've ended up training their people, but I think a piece looking at like training people on like CPR. I mean, I think when we had one of the meetings with the nonprofits here, they all mentioned sending people to other areas to get the training. I mean, the more people in town that have access to CPR and AEDs, I mean, the more of a like healthy community we are, right? We could have the community out there like mobilized to be able to take care of stuff like that. So I think that that's definitely.
In my senior community, we had 6 AEDs and we had a contract with Philips.
Okay.
It was their devices.
Yeah.
And so they had a recommended physician who would oversee the training, and they'd have a person come out and do the training of our select staff.
Yeah.
But it was an interesting program, but
Yeah.
the biggest challenge was just keeping the batteries up on the darn things.
Yeah.
Because they didn't have gas, right?
Yeah.
You know.
I think that's all great. I mean, I think that those are all like areas that, you know, I mean, as far as priorities that we can look back on and say, hey, like we tasked the district to do these certain things and come back, you know, what's the progress, where are we at, you know, what sort of impact does that make? I think that that's great. Another thought just off the top of my head here is we've talked a little bit about the fentanyl crisis and some of that stuff, you know, I mean, as a strategic goal to try to attack that somehow, you know, like I think that that's another one of the, you know, health areas in our community that there's a way for us to make an immediate impact and to be able to look at a 5-year plan and say, hey, we did something about this crisis, you know, at least in our community. So I'd be, you know, interested in potentially looking at that, you know. Any community comments, Roy? Yeah, for sure. Yeah, I mean, I was looking to see if that looks like Tom left. What do you got, Roy? Like, we're definitely interested in any of your thoughts.
I think Terry is on the right track. 15 years ago, if you had done a survey and asked the community, if the health district folded tomorrow, would it affect your life? I think a majority of people would have said yes, because at that time, it would have meant the closure of the hospital. If you ask that same question today, I'm not sure what the answers would be. I think there needs to be a sense of urgency that the health district needs to ask itself, what are we doing to improve the healthcare of the community? And what are we doing to do that to a point where we are invaluable to the community?
Indispensable.
And yes, indispensable to, and I think that motivation is what should be behind the mission statement and all the goals that you're working on. We need to have the health district so valuable that there would be an uproar if it was going to shut down or close or change. And I just wanted to throw that out.
Good point. Good point.
Yeah, no, I appreciate that. I think you're right in a sense, like that definitely if you were to ask the casual citizen, they would probably have no idea, you know, but
What is that?
but in reality though, if you were to dig a little deeper and ask some of these nonprofits, well, hey, like if you know, you didn't get that grant money next year, how would your program look? I mean, there'd
Yeah.
probably be a
Well,
lot
the
of consternation
pitchforks
at
and
that
the
point.
tar
Yeah.
would be out.
Yeah, but we want to be more than just a conduit for cash.
For sure, yeah, no, I agree.
Yeah, we're better than that.
Yeah. I think that there's definitely a lot of ways that we can look at our role in the community, and there's a lot of things that we can attack. I mean, I think like Roy had mentioned, like making ourselves indispensable. I think, you know, like it's definitely a thing, but I think as a district, we should be looking at trying to make measurable changes in the community as far as health, so that we can look back and say, hey, we did X, you know, like the last 3 years, this is what we've done. Some of the stuff's been a little bit nebulous, just like, hey, we've kind of bought the building and we've done different stuff. And I know there's been amazing stuff that's happened there, but you know, looking at the strategic plan, I'm really hoping to kind of put some set numbers and to be able to look back after a couple of years and say, hey, like, we did that. That was a great accomplishment.
You know, when we get that parking lot in, we'll be in big shape.
Do you have anything? They kicked you off at the end of the table.
We ran.
There's no room here. All right, well, I think that was a good discussion. I think, you know, moving forward, we'll kind of condense some of this information and take it back to the strategic planning committee. Hopefully we can kind of put some of these ideas in a more organized sort of way. And then we'll come back to the next December board meeting and maybe have just another short discussion, kind of move that.
Could we go ahead and keep G1 as a repeat? It's basically the 5-year plan discussion and goals and stuff. So add that into next month's. And then just we can follow up with it.
Absolutely. Yeah, that'd be good. And then I would open it up to any of the board members to just, you know, continue to brainstorm and think. Same thing for staff, any ideas that you guys have, anything that you'd like to contribute, community members, anything, you know, feel free to pass that information to Rachel or send it to me. And we'll definitely try to incorporate that and I mean, obviously, we're trying to be as inclusive as possible with this and get as much buy-in as possible so that we all have strategic direction and we're all kind of rowing the same way. So, you know, I definitely implore you to send any of your thoughts and really just kind of continue that thought process. You know, it's kind of an open thing. And hopefully we'll come into the next board meeting and we'll get a little bit more firmer direction and then kind of go into the new year, because I think it's important for us to kind of go into 2024 with a set direction. And especially, you guys haven't had to deal with this yet, but the election year coming up and the potential for, you know, a flip of a couple seats. I'm not sure how it'll happen or not, but you know, there's always that potential for in November, there's some change. And, you know, as a board member that's been through some of that, I would like to kind of cement some of this strategic direction. When we get to that point. You know, whatever happens.
Well, and to that point, Bill, you know, as we were working on building the agenda, obviously, we put just a couple of the bullet points that were echoed. So I do want to make sure that we're talking about strategic use of district facilities. I know that has been brought up many times. The idea, and this came out of the webinar that you also pointed your colleagues to. Do we want to do an in-depth district strategic plan that is facilitated by a third party instead of just us trying to figure it out on our own as well? That is.
Yeah, I'm not super interested in that. I know what you guys' thoughts are. I kind of think like we've got our mission statement, and I think that as a board, we have an idea. I think the staff has an idea of kind of where we want to go with it. I would be more open to that if we have any sort of issues coming up with a good plan or whatever. But I mean, I'm kind of the thought that we don't really need to invest in more consultants. I think that we have a good idea of where we want to go with it, you know, and yeah, that's my thought. I mean, I think that we kind of good. Hopefully we continue to have good, robust discussions and, you know, kind of flesh it all out. But
Yeah, I appreciate the opportunity to pass it on to somebody else, but nobody knows our thoughts better than us, and we'd be doing nothing more than sitting down with a third party and having a discussion session for hours on end, ad infinitum, give them our ideas, and they could do nothing more than go back and write it up, so.
Yeah.
I'd rather us do.
Yeah.
Yep, but I appreciate being able to pass it on to somebody else, but I'm good.
Yeah. I think as long as we all just kind of do our research and really kind of just dedicate some time to thinking about it, I mean, I think that our ideas are, you know, pretty consistent. I don't think anybody's coming up with any weird different strategic objectives. It's been kind of the same stuff that we've discussed over time and just kind of putting it in a good framework and giving the staff a better, like, hey, this is where the direction is. So, I mean,
At the end of the day, it's a tool that we want to have for our own use, really, when you get down to it, helping our decision-making process.
yeah.
I've gone through, I have driven strategic plans, I have used consultants in the past. That is driven by the knowledge base of the people doing the plan and the acceleration and time you need to get it done in.
Yeah.
My fear is it's not going fast enough. So if, I think we need to get some sort of an end zone on the docket here in terms of when this thing's gonna get done. And I heard what you said, I think, you know, before November, there's a starting date.
Yeah.
Or before even, you know, election time.
Yeah.
I think it needs to be quicker than that. And the facilitators are more around driving to conclusion and removing the fluff and getting to the real hard dirt that we gotta get through.
Yeah.
You know, I've said this, I'm happy to have, you know, if we need more discussions around this to accelerate.
Yeah.
I'm open to that. I don't know how that worked in the past or how we do that, but.
Yeah, I mean, I'd be open, you know, I don't know, we usually have like that, workshop at the beginning of the year. I mean, maybe we can use that workshop like in January as a hopefully a ending point of coming up with a conclusion of the strategic plan. I think typically in January, we'll do that if we kind of continue that discussion along the next couple months, and then if we needed a good 3-hour session here on a weekend or something to kind of just.
Yeah, I mean, our essence is, can we have the plan done by February 1st?
Yeah.
So there's our goal. So how do we get there?
Being able to have something pretty solid, certainly a draft by February 1st, certainly a full plan done by the end of that third quarter, first calendar quarter. Makes a lot of sense.
Yeah, yeah. I'm good with that. I mean, I think that's pretty correct. I
If
think
that
if we-
works for the work plans.
If
and
we
the
can
things
get
we gotta
that done by February, I think that we, you know.
Then
gotta
we're
start
subject
asking
to the
some
election,
questions.
right?
Don't forget we're recording.
I'm totally okay.
Okay, it's a board self-imposed deadline.
Yeah.
Okay, we got, it's gonna be in the minutes.
Oh, right.
Yep.
I threw it out for discussion.
We refer to the election season as the silly season.
Oh, yeah, no, absolutely. It's the sign season. All right, well, I appreciate everybody's discussion and staff's input and Roy, I appreciate it. You know, we'll continue that discussion in the next couple meetings, and you know, like I said, really appreciate everybody's thoughts. So that's really it. Do we have any board member comments or any items for subsequent meetings?
I just wanted to say that with regard to our last meeting that we had, I just wanted to say that I appreciate our CEO trying to rein me in when I was getting way out of hand last meeting, and she was absolutely correct. And I appreciate her keeping me on the agenda, and I appreciate that.
Thank you for that. Again, that's also our amazing board secretary, who is also working to make sure that we are compliant. So
Fair enough.
I would say the team appreciates that.
Thank you.
Thank you. Anything else? No, okay, we have a number of upcoming events coming up, committees and different stuff going on, so hope to see you guys there. Other than that, our next board meeting is, December 13th at 6 p.m. right here.
And that will likely also be the same public hearing that we will hold for Site Logic.
Understood.
So it'll be a longer meeting, but we will, by having this full consent agenda, we're actually opening up a lot of time for dialogue.
Yeah,
So it is.
I mean, I think this one with everything, I mean, it's.
Absolutely, this was awesome.
And we'll be followed up with our very first
Foundation meeting,
Yeah.
congratulations.
Yes.
Team.
Good job, good job.
So the new IRS staff, they got like, got right on that, huh?
Yeah, it only takes 6 months, that's all it takes.
Okay, well, we'll go ahead and adjourn. Thank you.
Thank you.
And then somebody asked Site Logic if they had done any military housing. Does it
I think there was military installations, I think, for
Well, it was
similar
military
programs. to the
housing. Because they do want military housing. Anyway, somebody had asked and John gave me these. methods.
Bye, you guys. Have a good night, Roy. Have a good night.
Thank you.
Thanks, Roy, bye. You guys should have a staff meeting now, you're all here.
Yeah, for sure.
Oh, that's tomorrow. We debrief after y'all are done.
Yeah, y'all, they're